Hello, my name is Dr. Jonathan Morris, and I'm an orthopedic oncologist at Emory Healthcare. I began college at Georgia Tech studying to be a mechanical engineer, and as I was finishing my master's, I fell in love with the human body and the mechanics behind it. I graduated and went to work in the engineering world, but never lost interest in the human body. So after some time, I decided to go to medical school with plans to be an orthopedic surgeon, and the rest is history. One of the fascinating things in orthopedics is that every case is unique, and so each surgery presents itself with its own mechanical problem. Whether it's resecting a tumor, revising a joint replacement, or treating someone's arthritis, every case is unique and we get to come up with a patient-specific solution for each patient. Within the Southeast, Emory offers a comprehensive, multidisciplinary service with surgeons specializing in different realms of orthopedics and other subspecialties, so we can combine our efforts to optimize our patients' outcomes. Also, being part of an academic health system, we have a collaboration between the academic side and the clinical practice side. I have the opportunity to work with a variety of researchers who may or may not have the clinical access, but they do have the experience in basic science to create translational research so we can move research from the workbench to the clinical realm, and that is very exciting. Helping my patients understand the thought process behind coming to the decision to do surgery, why we're doing the surgery, and what it takes to recover from the surgery is important. Shared decision-making is essential because in some of these complex problems, we have to balance not just what's going on with the extremity, but with the whole person. When I'm not at work, my family keeps me busy. We enjoy anything outdoors, running, hiking, biking, and swimming. I also enjoy woodworking. In closing, I look forward to meeting you and starting our healthcare journey together at Emory.